Hi everyone, and thanks for coming. I wanted to talk to you a little bit about how this came about. So the National Roundtable was held in Canberra on the 22nd of May 2013. It was an amazing event. The people with formal authority in that room were astonishing. There was, I can't even begin to tell you, there was secretaries of departments, there was the CEO of the NDIA, there was I don't know who else was there. You were there, Nick. Who else was there? Yeah. The list goes on. Plus us. So clearly, all the important people. So the Queensland attendees were me, Nick Lennox, Director of Queensland Centre for Intellectual and Developmental Disability, who is our partner in running today. Kathy Franklin, also from QSID. Greg O'Brien, who is a clinician. Veronica, who I think was a carer, Consumer Voice. And Bill Kingswell, the Chief Psychiatrist. So some of those people are here today. Interestingly, as Leslie was talking about, one of the things they asked us to do at the National Roundtable was make a personal commitment to what we could do when we went back to our workplaces and homes. For me, it was two things. I made a personal commitment that my son, who has an intellectual disability, should have probably an assessment, given the numbers and also my observations of some of his behaviours. And the other thing was that perhaps to see if we could gather that group together again and see what else we could do. And I saw an opportunity when I met Leslie to ask the Mental Health Commission to fund this work, to fund this state roundtable, and she was very keen to do that. So thank you to her. And we formed a partnership with QSID, also with Queensland Voice, and I'd like to acknowledge Noel Muller. Are you the Director of Queensland Voice? What important title have you got, Noel? Yeah, Dog's Body, there you go. And Paige Armstrong from Queenslanders with Disability Network. We thought that, Leslie said to me, how are you going to manage that many partners? I said, watch us. We do this stuff well. All of these partners do this collaborative work well, and I hope that that's reflected in what we do here today as well. So certainly we'll have a bit of a discussion around where the gaps are. We can't ignore that. But then towards the end of the day, we'll be talking more about what are some of the solutions, what are some of the will-dos that you can take with you today. What's next, Kath? So I just wanted to introduce you to the key elements that this was the framework that the National Roundtable was held in. What are the key elements of an effective system of mental health care for people with intellectual disability? So the first one was inclusion around intellectual disability mental health in all mental health initiatives. There's plenty of mainstream initiatives out there, and usually people with intellectual disability are just ignored, regardless of the tens of thousands, as Leslie pointed out, that are affected. Prevention and timely intervention. Equitable access to and skilled treatment by mental health services. We're here to attest that today I think that there's only 2 people out there in private or semi-private practice that specialise, clinical psychologists that specialise in the mental health care of people with intellectual disability in Queensland. We'd like to see that change. Specialist intellectual disability mental health services to support mainstream services. So it was acknowledged that while we want inclusion, this is a group with very particular needs, and that at times there needs to be some auxiliary services, specialist services. Collaboration between disability, schools, mental health and other agencies, and I think that collaboration is reflected here today. We have people from all parts of the system, which is really encouraging. Workforce education and training. Luke and I were just talking about this, about the training in clinical psychology courses and professional development for clinical psychologists, but also training for the disability workforce in schools and so on. I can't say that. Enhanced data collection. We all know the paucity of data around people with intellectual disability, full stop, much less the much ignored problem of people with intellectual disability and mental health issues, and addressing contributors to multiple disadvantage. So this is talking about the kind of social determinants of mental and physical health and well-being. So they were the key elements. We'll be using them today as a framework again to continue that work. So I guess I'd hope that people will see this as Queensland's beginning effort, although I do know there is a very long history of work has been done in this field. So perhaps just a refresh of Queensland's effort and our contribution, and so that when Jim Simpson from New South Wales, I like saying New South Wales CID because it sounds really scary, from the Council on Intellectual Disability, who was a main driver with Nick, I think, and some others of the National Roundtable. Next time he emails us and says, what have we been up to, we can say that we've held the State Roundtable and here's the outcomes from it. These are the will-dos that people are going to take away from it. Okay, thanks. Thanks for being here.